Hi there, this is a 425 Human Sexuality Infomercial that presents to you Anal Stimulation, brought to you by Araceli Contreras. Anal activities can be seen as a taboo. People feel nervous and insecure about this activity because some are just not sure what to expect and some are just worried about being judged by others. Also, there's an assumption that anal activities are homosexual activities. However, anal activities can be heterosexual activities as well. In fact, an article done by HuffPost showed that 36% of heterosexual women and 44% of heterosexual men admitted to participating in anal sex. So anal activities in general can be given and received by both male and female partners. Overall, anal sex and stimulation is an activity that all can explore. So what are anal activities exactly? Well, anal activities can include anal intercourse, which is the penetration and thrusting of a partner's penis in the anus of other. And then there's also anal stimulation, which can be the use of oral to anal contact and manual stimulation. So stimulation for a male can occur by the brushing or rubbing against the prostate through the anal walls, which can then produce a pleasurable sensation and even lead to an orgasm. For a female stimulation, it is caused by the nerves such as the pudendal nerve that branches from the clitoris to the vaginal walls that then has a shared connection to the anus. And this leads to the pleasurable sensations and the potential orgasm as well. So today, social norms of anal stimulation includes the use of your fingers, oral to anal contact, penetration with a penis, and the use of sex toys such as a dildo. However, there are a few precautions that should be taken into consideration when considering anal intercourse. One would be that the anus lacks natural lubrication that the vagina has. So penetration can tear the tissue inside the anus, allowing bacteria and viruses to enter the bloodstream. And two, the tissue inside the anus is not as well protected as the skin outside the anus. And our external tissue has layers of dead cells that serve as a protective barrier against infection. And three, the anus was designed to hold in feces. So the anus is surrounded by a ring-like muscle called the anal sphincter, which tightens after producing a feces, but it can be weakened with repetitive anal activities. So a few tips for increasing anal sex safety would be 1. Avoid double dipping. In order to minimize the risk of infection, always wash your hands and genitals with soap before engaging in any other sexual activities. So maybe put on a condom or use a dental dam for any oral activities as well. And 2, you would want to use plenty of lubricant to reduce the risk of tissue tears, since the rectum is a delicate tissue, prone to small tears. And 3, you want to make sure that you're relaxed prior to any insertion, so start out small and slow. And 4, if there's any uncomfortable sensation or pain, you want to stop. And lastly, if you see anything or experience anything abnormal around the anus, see any sores or discharge, you want to see your doctor as soon as possible. So lastly, as a conclusion, practice safe sex in order to enhance your experience. Thank you for watching, and stay curious.